Assalamualaikum and good day, students. This is the lecture on adverse effects of transfusion. So, first, I start with a real-life situation in which a mother had a complication after given a wrong blood. This is a very real history happened in our country in which a mother which has a blood group O was given a blood group B. So the point that I want to highlight here is the complications of blood transfusion is very real, and we as the healthcare professional, be it doctors or nurses, need to aware that this complication can happen and we need to do anything to prevent this kind of complication. Alright, so for the lecture proper, I will introduce you to the definition of transfusion reaction. As we know, blood transfusion is an irreversible event in which we need to weigh the benefits against the risk of a particular blood transfusion to the recipients. The transfusion reaction is defined as any unfavorable transfusion-related event occurring in a patient during or after transfusion of blood or blood component. When you read many books, you will see there are many classifications occur. Some of the books will classify the transfusion reaction based on the underlying mechanism of how does that happen. Some of the book will classify it based on the cause of the complication, and some of the book will classify it based on the timing of the complication. Many of the books classify this as hemolytic complication against non-hemolytic complication, infectious against non-infectious complication, immune against non-immune complication, or acute against delayed complication. These complications of blood transfusion are mostly mild with overall incidence of 1 to 2%. But however, we have fatalities around 1 in 100,000 to 500,000 patient transfused. And majority of deaths were because of preventable errors. And half of the deaths are due to ABO incompatibilities in which patient was given wrong blood, and this can occur in 1 in 6,000 to 30,000 patients. What are the common errors that can happen and also leading to complication of transfusion? The first one is patient misidentification. This is most important when we want to identify a patient for blood sample before we want to transfuse the patient, and also identification of the patient when we want to transfuse a patient with a blood component. The second one will be the sample error. The subsequent reason is wrong sample was issued, in which there are a sample mix up in a ward. For example, if there are more than one patients that need transfusion, so we want to take blood for pre-transfusion testing, but there will be a risk of mixing of blood from different patients if we take the blood sample together at the same time. Other errors can happen is transcription errors, in which we probably label or wrongly fill in the blood request form. Administration error, as I have mentioned, in which we have transfused wrong patient to a particular blood. The subsequent one is the technical and also the storage error. Okay, let's discuss about the causes of the complication. In here, I have divided it into a non-immune and immune complication, and also acute and delayed complication. Acute complication usually when the complication happens within the 24 hours of transfusion, in which delayed are after 24 hours up to months after the transfusion. The non-immune complication, in which there are not a direct immune mechanism involved in that complication, whereas in immune complication there are direct immune mechanism that cause the complication. So the acute non-immune complication will be, for example, bacterial contamination, hypothermia, hypocalcemia, which is usually occur in infants, air embolism, and also volume overload. for immune complication in acute phase of transfusion is febrile non-hemolytic transfusion reaction, acute hemolytic transfusion reaction, allergic reaction, anaphylactic reaction, and transfusion-related acute lung injury, which sometimes we call as TRALI. The delayed non-immune complication will be all the infectious complications such as HIV infection, hepatitis B and C, CMV or cytomegalovirus, other virus such as parvovirus B19 infection, hepatitis A, malaria, Chagas disease, and also the iron overload. The immune complication is delayed hemolytic transfusion reaction, post-transfusion purpura or what we call as PTP, transfusion-associated graft versus host disease or TAGVHD, and also immune modulation. Some of the common ones will be discussed in this lecture, but the rest, if you want to know more, you need to read about it. Okay, what are the possible signs and symptoms of a blood or blood component transfusion reaction? This is very important for you, especially the nurses, because you are the first liner that usually be there at the bedside of the patient most of the time. Okay, so you need to be aware that these are the possible signs and symptoms of a transfusion reaction. Okay, we have the pyrexia, which is fever, ricus, hemoglobinuria, nausea, vomiting, breathlessness and coughing, restlessness, agitation and confusion, flushing, pain at the chest, abdominal, muscle, bone or loin, urticaria, in which the patient will complain of the rash, which is an itchy rash, diarrhea, headache, abnormal bleeding, collapse, or sometimes the patient generally feeling unwell. So when a patient undergoing a blood transfusion and they are complaining that they are not feeling very well, so you must take that complaint very seriously. It might indicate the earliest sign and symptoms of a blood transfusion reaction. Okay,